Hello, everyone, and welcome to today's Health Policy Institute webinar. My name is Marko Vujicic. I head up the Health Policy Institute at the American Dental Association. I will be chairing today's webinar, where we're focusing on data collected last week in our ongoing poll of dental practices in the US, focusing on understanding the economic impact of COVID-19 on the dental care sector. Today's focus will be four areas. We will, as usual, give an update of where we are on our latest tracking data that we've been collecting every 2 weeks. This time, we're going to take a closer look at 3 states, just as an example, where COVID cases have been on the increase. And one of the central things we're trying to understand is, in settings where the population is seeing spikes in COVID cases, are we seeing any impact on dental practices in terms of patient volume, for example? We also have question of the week, a couple, focusing on teledentistry this week, and also focusing on why we are not back to full staffing levels in dental practices. And in our view, number 4, and perhaps most importantly, we'll be sharing some new research from a consumer insights firm we've partnered with on how the public is viewing dental care visits during the pandemic. So let's get into what the latest data show us from the week of July 13th. Actually, before I get into that, this is our usual slide. I won't go into the details. The only thing I do want to highlight is we have seen a slight drop in the number of responses in the last few waves. A couple of people had sent in questions last webinar and the one before. Is this potentially introducing some bias? For example, if the busiest dentists are more likely to drop out of the poll, that could affect our results. We looked into that between last wave and this wave, and for various reasons, we don't think it's a major issue. We did not find any differences in characteristics and even in busyness levels of the people that have dropped out of the poll versus those that have remained in, obviously, the week before. We don't know in real time, those that have dropped out, what their busyness level is. But if we look 1 week before they dropped out, they looked very, very similar to the dentists that did not drop out in all those measures. The other thing I want to highlight at the bottom here is we have a state-level interactive dashboard where you can look at various cuts of the data state by state. You can cut it by DSO, non-DSO, you can cut it by the age of the dentist, etc. That's all on ada.org/HPI. And as usual, you can download the report, which contains all of the charts I'm going to show you today at our webpage as well. Finally, many times folks ask us for, well, have you looked at this in the data, or can you ask this next week, or have you cut the data by this age, or have you cut it by region, etc. We have the capability to do all of this. We're showing today the aggregate results. Obviously, this is a very, very rich data set of thousands of dental practices being tracked in real time, frankly. For several months now, I guess a couple months now plus. And as you all know, HPI launched a consulting subunit within our team, focuses basically on doing custom analytics and data analysis for the private sector. If you're interested in more robust analysis, maybe on particular issues or particular specialties out of these data, you can us at hpiconsulting@ada.org. I'll put all this up at the end. And as well, we are offering the chance for vendors to potentially place customized questions that only you would get the results for. And if you're interested in exploring that opportunity with us, again, just get in contact with us, and potentially we can work on a project of that nature. Okay, let's get into the core questions. So as usual, the bottom bar in all these charts is the new data. And here it is for what is the status of your dental practice. Basically no change in the last 2 weeks. 98% of dental practices in the US are open. That hasn't changed between week of June 29th and week of July 13th. So this is pretty stable. Really important finding in this chart, patient volume. As you see in here, we've had one of the big things we've been showing is the robust rebound in patient volume in dental practices in the US. Very important finding, this is leveling off. And you'll see this a bit later in our quote unquote early opening states, it's fully leveled off. But nationally, patient volume is leveling off. It's at about 71% of pre-COVID levels for the week of July 13th. And again, largely unchanged. One thing we do want to flag here is we are estimating that number on the right from these categorical variables. It is a consistent way of measuring it over time. We do, however, feel we might be underestimating this slightly because we're taking the midpoints of these categorical variables. So basically changes from, let's say, 80% of patient volume to 90% of patient volume in certain practices, that won't really get picked up. So bottom line is this might be a slight underestimate of what the true patient volume is on average, just because of the way our data are organized. But most importantly, as a trend, things are starting to level off, and that's the important conclusion we're taking out of this. This week we are publishing some results by specialty. You can get the full report online at ada.org/HPI under our COVID tab. But I did want to pull out, there are some variations in patient volume by dental specialty. For example, here, the specialties at the bottom have less green and more yellow and orange, meaning they're slightly less busier in terms of patient volume than these specialties up top. So you can dig into this. There's more detail online. We also cut these data by specialty for all of our core questions. In terms of collection rates, again, what we're seeing here is, number one, collections lag patient volume. We've seen that both on the downswing during the shutdown phase. For example, patient volume plummeted and then collections declined slowly. On the upswing, it's the same thing, patient volume jumping, but collections lagging a little bit. So we continue to see collections here increase and catch up, quote unquote, to patient volume. So nationally, collection volumes were at about 2/3 of pre-COVID levels as of last week. And this is consistent with what we've been finding in previous rounds in terms of that lag. Finally, our third core question is related to whether your practice is paying staff this week. Again, comparing the bottom bar to the second to bottom bar, not much change. So things are stabilizing here at around roughly 90% of pre-COVID staffing levels. So already in these first few charts, we're seeing things kind of stabilize. Same share of practices are open, 98%, nearly all have reopened. Patient volume is tapering off, but stabilizing at somewhere in the low 70s in terms of percent of pre-COVID levels. Collections still increasing, but we know those lag patient volume. So I expect in the next couple of rounds, collections to taper off and level off. And staffing here is largely unchanged. So we're starting to see kind of a steady state, quote unquote. Okay, and then we ask also non-employee dentists. This is one of our focuses as well. Are you being paid fully? So this question asks the practice owners about their staffing. This asks the associate/employee/independent contractor dentists, are you being paid this week? And again, the bottom bar showed a slight increase in the green. So definitely that hiring in recent weeks has been concentrated on employee dentists. Those have been the biggest kind of dental team members that have seen hiring increases. So one of the insights is recent hiring has focused on employee dentists. About 70% of employee dentists are now being paid fully. Another 21% in yellow there are being paid partially, and about 8% still are unemployed or not being paid at all or furloughed. So it's interesting. We think this probably won't change much because aggregate employment is flattening. So my guess is we're going to stabilize around, let's say, 70% or maybe 3/4 of employee dentists being hired back full-time and being paid fully. So definitely there seems to be a potentially long-term impact here on younger dentists, non-owner dentists. And what's really interesting is I want you to note this bottom chart here. We asked the 8% of non-owner dentists who are not being paid at all, what is the main reason you haven't been hired back and are not being paid at all? So we take again that 8% in red at the bottom bar of the top chart, and we ask them the question that is, if you are not being paid at all, please indicate the primary reason why. And the choices were, well, the practice cannot afford to bring me back at this time, which is like involuntary. I'd like to go back, but they're not willing to hire me. The next one, the teal, is I do not want to return at this time, which is voluntary. So as you see there, the majority, 62%, indicated that they'd like to go back, but the practice isn't able to hire them back. And 28%, it's voluntary. They're either not prepared to go back, don't want to go back for whatever reasons. So make a note of this. The main reason employee dentists who are not working give for not working is that their employers don't want to hire them back. Okay, PPE, we've been tracking for several waves here. We've just added the last one on the bottom as usual. Punchline here is no big change in PPP availability. And we put for now. Obviously with resurgence of COVID in I think 38 states, don't quote me, I'm not sure. But in many settings, we don't know where the PPE supply chain will land in terms of increased consumption of PPE. Certainly the past months have seen dramatic increases both in domestic production, and PPE is flowing much more robustly than at the start of the pandemic. But again, we don't know where things will go. We don't know what directives will be given to preserve PPE for frontline health workers again. And I'm not talking within the dental community, I'm talking more within governors and health authorities. But certainly for now, we're not picking up, as of last week, any change in PPE stockpiles in dental practices. All right, now we want to dive into the state level data. So here I've just taken screenshots of our dashboard, but you can go and play with these data online. So again, we're going to look at Texas, Florida, and California, 3 states that are seeing surging COVID cases. And here I want to show patient volume. So the color scheme's a little different here, but let's get oriented. Dark red is very low patient volume compared to pre-COVID. And as you move to the right and get to the orange and then to the yellow finally, it's higher patient volume compared to pre-COVID. So the more red you see on these plots, it means patient volume is very low. The more yellow you see on these plots, you see patient volume is high. And we just basically wanted to check the last 2 bars on this chart on the bottom and compare them. So the question here was, if I look statewide at Texas, and I know statewide is rough, but those are the data, do we see any change or any decline in patient volume last week in Texas compared to 2 weeks prior? And the answer is no. The patient volume is stable in Texas, at least for now. There hasn't been any appreciable clawback or reduction in patient volume last week as a result of the increasing COVID cases. The other, sorry, we go here. So that's for Texas. Okay, I think we have those slides for Florida and California somewhere later down. If not, we'll make sure they're in the online version of the slides. Punchline though, California and Florida look the same. So in neither of these three states at the state level do we see any sort of decline in patient volume, at least for now. And these are three states that are seeing rising COVID cases. Okay, then the question of the week here. So one thing we asked is your practice back to pre-COVID staffing levels? So now we're back to asking the practice owners, are you back to pre-COVID staffing levels? And about, you see there, somewhere between 80 to 90% almost of practices told us, yes, we're back to pre-COVID staffing levels. For dentists in my practice, for dental hygienists in my practice, for dental assistants in my practice, and for all other staff in my practice. So a couple things, these data are aligning with both the Bureau of Labor Statistics, which is roughly saying it's about 90% of pre-COVID levels in terms of employment in dentistry in general. Our data are converging around the same. We estimate employment in dental offices is back to 90% of pre-COVID levels. These data are confirming that. Interesting thing, if you look at the top chart, is hygienists are the occupation that is lagging most. Only 80% of dental practices are back to pre-COVID staffing in terms of hygienists. So there does seem to be a hygienist-specific, I don't want to say issue, but of all the dental team members, hygienists are least likely to be being hired back. And again, we'll get into why, which is the bottom chart. So we asked practice owners if your staffing level is not back to pre-COVID, right? So those red bar respondents in the top chart get the second question below. Why aren't you back to pre-COVID levels in terms of staffing? And here we're back to those same responses. The practice cannot afford to bring them back at this time. So the practice owner would say, I cannot bring them back. I don't want to hire them. I can't afford to hire them, etc. That's the left purple bar. The teal is the staff members do not want to return at this time. And then other is the yellow. So what's interesting here is you see, for dentists, for example, you see a different response, right? Remember before when we showed the chart for what employee dentists are saying is the main reason they're not being hired back? 62% of those employee dentists said it's because the practice does not want to hire me back. Here, if we ask practice owners who are less than full staffing for dentists, this response here, a different number emerges, right? Here, the practice owners are saying in 30% of cases, it's me not wanting to hire them back. In half the cases, it's that the dentist doesn't want to come back. So these data are inconsistent, right? The practice owner responses do not align with what the employee dentists are. And we're just thinking the reality is probably somewhere in between. But the main punchline in this bottom chart here is the majority of staff, according to these data, are not being brought back because the staff members don't want to come back. It's not, I would have expected these data to be much more in the purple color, that people want to go back to work, they just don't have jobs for them. That's not what these data are suggesting. They're suggesting that the main reason staff are not being hired back is because the staff don't want to come back. And again, you see hygienists have the biggest response there. This almost 2/3, right? So almost 2/3 of the, let's say, understaffing of hygienists in dental practices is explained by hygienists not wanting to return to work. Um, so I won't read the insight there. I think I paraphrased it, but really important insight. So again, the punchline so far is we're back to about 90% of pre-COVID employment levels. And the reason why we're not back to 100 is not necessarily because there's not enough business or not enough patients or that the practices don't want to hire back staff. Definitely a major issue is the team members don't want to come back for various reasons. Okay, and then here, just wanted to, because the team has done such a wonderful job with Matt Michelson and Rachel Morrissey and others who work on this. In terms of analyzing the qualitative data here, I just wanted to highlight those, right? So if you go back here, well, here, there's about 20% of practice owners that are giving some other reason in terms of why the staff aren't being hired back. And here are the top ones, right? So, spacing issues, social distancing. Maybe that refers to, look, we have enough patients, the staff want to come back. I simply don't have space because of how we're operating physically, right? That's what this is saying. Dentist took another position. Okay, that's important, right? That's an other, but that dentist has gone off and found a job somewhere, right? It's not like they're, and then you have family medical leave. What surprised us a little here was the reason at the bottom, which is the dentist passed away due to COVID-19. And it's a very small percentage. I actually don't know the actual number of those, but it did make it up into the top 6. And the second to bottom region, dentist shortage, right? I can't find people to hire. So it's very interesting how this pandemic has really, and again, I feel this is a real asset of this tracking poll and the fact that we could add questions like this to get at the insight, right? We're probably at maximum capacity in the dental care sector now in terms of caseload. It doesn't look like the staffing can move more. If you're on our webinar 2 weeks back, right, we showed that the number of patients being seen in dental practices is actually really close to what the practices are saying is their maximum capacity under the new guidelines and care protocols. So in my view, patient volume is not back to 100%, right? It's somewhere in the low 70% of pre-COVID levels. But frankly, these data are suggesting it can't really go much higher. There are staffing issues, practices aren't back to full speed, and they can't necessarily get back to full speed due to the reluctance of many of the staff members to want to come back. And so when we get to kind of the consumer insights data, you'll see all this ties together to a really nice new normal story. Okay, the other question for hygienists. So why aren't hygienists being hired back? Again, practice can't afford to bring them back. Hygienists don't want to come back. And here are some of the other reasons. Again, we're back to spacing issues. Simply can't physically fit the same amount of staff before because of the new protocols. And again, shortage. I can't fill the position. And then enhanced leave, etc. Okay, our other question of the week relates to teledentistry. We basically re-asked the question that we asked the week of April 10th. So we asked, is your practice using virtual technology / telecommunications to conduct remote problem-focused evaluation? So it's a very specific question. And if you recall, the week of April 20th, we had about a quarter of practices using teledentistry. And that's dropped off now. That's down, I guess, cut in about half. So about 12% of practices are using teledentistry. And when we look at who it is, it's largely the DSO / large groups. So teledentistry use is dropping. It appears to have been a temporary stopgap measure during the shutdown phase of the pandemic, at least for solo and small group practices. DSOs and large group practices are far more likely to use teledentistry. But still, we look at these data, red is the overwhelming choice here. I'm not sure teledentistry is going to stick or take off as a result of this pandemic. Again, we can talk more about that, but certainly on the medical side, we're seeing that, but we're not seeing it on the dental side. And again, I guess for logical reasons, I would say there's a huge difference in who uses teledentistry according to practice size, right? It's the larger groups that can invest the technology, they can run it, they can use it efficiently. The small practices, well, I'm hypothesizing, but the small practices probably see less ROI on teledentistry, and the data support that. But there could be other hypotheses. Okay, so we found our Florida data. So again, here, it looks like maybe a slight increase in the dark bar here. This is actually whether you're open or not. Well, let's skip that. Let's go to patient volume. Okay, so here's the patient volume for Florida, similar to the chart I showed for Texas. Again, compare the bottom two bars in this chart. No real change in color patterns. So nothing in terms of patient volume declining in Florida. And ditto here. And in terms of patient volume in California, we're comparing the bottom two bars here and no real change. So these three states, again, we just picked three as an illustrative example, and we got lots of sample size in these three. They're not showing, at least for now, any sort of decline in patient volume, even though we know COVID cases are rising in the population. But we did something more formal and more fancy, and thanks to Andrew Blatz and the team for leading this part. Here's what we did. So I don't know if you remember, early in the pandemic, we linked up the Johns Hopkins COVID infection rate data to our polling data. We did that again last week. So what we're trying to do here is answer the question, how is patient volume varying according to the COVID infection rate in the particular county that that dental practice is located in, right? So one hypothesis is if COVID infection rates spike among the population, and that does lead to decreased patient volume, we should see patient volume be low in relatively high infection rate areas, and we should see patient volume be high in relatively low infection rate counties and regions. And we don't see any of that pattern. So what this is showing here is we break the US up into three types of areas: high, medium, and low in terms of the COVID infection rate. And again, these are new cases per capita last week. So this is a very recent measure, and it's matched to our polling data. So those are the three categories of region. And then we basically see, okay, dentists in those regions, let's see how they're reporting patient volume. Anyway, these bars all have the same color pattern. There's no difference. So our conclusion here is patient volume, again, at least last week, patient volume does not appear to be correlated with COVID-19 infection rates. And again, we merged county level data on the number of new COVID cases the week of July 13th with our polling data. That's how we did that if you want the semi-wonky explanation. But the point here is consistent with what we've shown in Florida, Texas, and California. A more robust analysis merging all these different data confirm that there doesn't seem to be a patient slowdown in regions that are seeing COVID cases spike. Okay, that's the aggregate one. So as usual, I want to quickly go through now the early opener states separately. We do this every webinar. We want to now look only at the 27 states that have reopened for dental care early. These are what we call our early opener states. And they've been kind of going longer now. So let's see if patient volume is leveling off there. Because again, this group of states we think is telegraphing the new normal a bit earlier than the national data I've just showed you. So let's again take a look. So here no change now for roughly 3 waves of data. So the last month here has been pretty stable, and 98% of offices are open. So these early states now look very much like, well, the national average now mimics these early states. That's what we're seeing here. Everybody's at about 98% in terms of the percent of practices that have reopened. Right? Patient volume here has been pretty stable for 3 waves. This is really important. So all these data are aligning. So if we look at these states as predictors or telegraphing what the national data look like, we've basically reached the point where the national data mimic these 27 states. So, and it's interesting that the patient volume is leveling off at roughly the same amount. I'm going to call it low 70s in terms of percent of pre-COVID volume. And again, we think this is a bit of a lowball estimate, but frankly, not by that much. So again, all these data are suggesting we definitely slowing, the rebound is really slowing, and we're hitting this steady state / new normal. And it's roughly at, let's say, 70 to 75% of pre-COVID volume. That's what the normal appears to be, both nationwide and in these early opening states. Same thing here, I guess a little bit higher, but practices roughly at about 90% of pre-COVID staffing levels. So this looks similar to the national data. And all that is to say here that maybe next webinar we won't even show these 27 states separately, because to me it's converging. The national averages are converging on these early opening states. I'm very happy we tracked these 27 early opening states because they have telegraphed, and it is turning out to be true that they are predicting a little bit sooner where the national numbers are going to end up. And again, I encourage all of you, we have these numbers state by state. States are very different. Some states are seeing much higher patient volumes than others. You can go look at all this. Those are available publicly. And again, if you're interested in more custom, like for example, I'm interested in these 6 states and I want to look at DSOs versus non-DSOs, or I want to look at by race or gender or age. We have the capability to do all this. We don't. We're trying to give the national data, barometer data for free for everybody. But if you're interested in your particular markets you want to look at, please get in touch with us again at hpiconsulting@ada.org. Last part of our webinar is going to look at consumer insights data. And this is really exciting. So as I mentioned, we've partnered with a leading consumer insights firm. These are some of the media hits they've got in the last few weeks. But basically, we partner with them to add some dental-specific questions on a very representative household survey that they run every couple of weeks. So I want to show you kind of what we found together with them in terms of the dental care questions. So I think I showed this chart a few weeks back, but it's updated. This is probably the biggest insight of this whole webinar. I want to spend a little bit of time on this. So we basically had them ask this question, and they do this for various industries, so it's kind of a canned question, but which of the following is closest to your current point of view, and then in terms of visiting a dental office? Now, the people that get in the pie are people that have gone to the dentist in the last year, right? So it's not everybody, it's those that had a dental visit in the past year. So these are patients. And 4 options are given. You can indicate, yep, I'm ready to go, which is the bottom teal. You can indicate, I've already gone to the dentist, which is the green. And then you can indicate either yellow or red. And red is, I would not be comfortable resuming this activity, i.e. going to the dentist, unless there was an approved COVID vaccine or a proven medical protocol to mitigate and remedy the effects of the virus. So we can think of these as the very cautious, risk-averse group that is not going back to the dentist until COVID basically is curable or preventable. And then yellow is I would be willing to resume this activity, i.e. go back to the dentist, as long as a combination of local or national medical authorities, government officials, or the location I'm visiting, i.e. my dentist, provided assurances it is safe to do so. So what these data tell us is that there's roughly 3/4 of the population that's either ready to go or is already gone, right? So they're kind of no issues visiting the dentist. And it's interesting, our patient volume is somewhere around that amount, right? 71, 72%, right? So if you add up the green and the teal, you get 72%, either ready to go or have gone, right? And I think recently active was either the last month or I don't exactly remember. The yellow is the assurance seekers, which are willing to go with some nudging and with some assurances, and the red are kind of like, hell no, not yet. So what we took from this type of analysis is that, frankly, at least in the short term, the upper bound for patient volume is probably, 86% of pre-COVID levels. Everything but the red. The red people are saying, I'm not going. I'm not going till there is a proven vaccine or treatment. And these are folks that are patients. They have gone to the dentist last year. So if you believe these data, and we do, it suggests that, again, once we get through kind of pent-up demand and emergency issues, in my view, our ceiling for patient volume in the short term is, let's call it 85% of pre-COVID levels. And we're approaching that according to our data. Let me just skip to this, because this was another very insightful thing we asked last week, or they asked. We wanted to dig into, would your viewpoints change here if you knew that there was a COVID transmission happening, or that it happened in a dental office? So let's read this actually. Let's assume that you became aware of a situation where someone in your area was confirmed to have contracted COVID-19 from a visit to a dental office that you were not personally a patient of. So which of the following best reflects your willingness to visit your own dentist? So we thought here, basically, you hear a news story in your area, in your city, there's some case of COVID that was transmitted by the dental office. How would your viewpoints change? And I want to focus here most on this red bar here, or this red slice, sorry. We do see some increase from 14% of respondents saying I would need a medical breakthrough to now 24% needing a medical breakthrough. But frankly, 3/4 are ready to go or need some assurance from their dentist, and they'll go. So what they took away, what Engages took away from this, was that basically local COVID cases in dental offices would not significantly impede visits, or would not necessarily cause kind of an appreciable decline in patient volume in that area. So these data are suggesting, again, largely that a significant share of the population seems assured and comfortable going to the dentist, 3/4 roughly. There's another slice that would need some assurances from the CDC, the ADA, their local dentist, etc., that protocols are in place. And by the way, if you've not seen, the ADA has launched the toolkit for dentists to basically have those communication tools with their patients. That's available at ada.org/virus. But there is a slice that is just not going to go till kind of the vaccine or treatment protocols are in place. So again, I would say these are encouraging data. And honestly, it seems to be that the public has a lot of confidence and faith in general in terms of dental visits. The more we track these data, in my view, the bigger issue becomes practices are not able to operate at full capacity. due to various reasons, including staffing. But it's not, at least in the short term, an issue of patients just not wanting to come back. Now, granted, a 15% decline in patient volume in the dental sector is significant. I don't want to trivialize that. If it is true that our upper bound is 86% of pre-COVID levels in terms of patient volume, that's not a trivial drop, right, in terms of economic activity. However, when you look at all sorts of other sectors of the economy, dentistry is doing much, much better. And other than physician visits, I mean, dentistry is number one. It's either number one or number two of things people want to get back to. And even outbreaks of COVID in dental offices don't seem to be, at least in this case, it suggests that they won't sway behavior that much. So let me summarize then, and then I'm going to just let Adriana come in shortly with Q&A. Let me just summarize, and I do want to read this because we put a lot of effort into giving the 30,000 foot level conclusion. So as of the week of July 13th, 98% of dental offices in the US were open. Patient volume was estimated at 71% of pre-COVID levels. Staffing was at about 90% of pre-COVID levels. These values were largely unchanged since our last wave of data collection and suggest we are reaching a steady state of economic activity in dental offices, at least for now. In Texas, Florida, and California, 3 states we examined with rising COVID infection rates, there does not appear to be any appreciable decline in patient volume. Our broader analysis, remember merging in the Johns Hopkins prevalence data, indicates little correlation in general between patient volume and the number of new COVID-19 cases among the population. If I were to add one more sentence, this to me suggests the public has a high degree of comfort visiting the dentist, at least a significant share of the public. New consumer polling indicates that about 72% of adults are very comfortable visiting the dentist right now, and another 14% are willing to go if they had some reassurance from their dentist, the CDC, or other authorities. The remaining 14% indicate they will not visit the dentist again until there is a vaccine or proven treatment for COVID-19. Accordingly, patient volume in dental offices likely has an upper bound of around 85% of pre-COVID-19 levels, at least for now. And if we put all this together, the data suggests the dental care rebound is tapering off, and we are reaching, if not already in, the new normal. So this is where you can get in touch with us. I want to bring Adriana in now, see where we are for Q&A. Nice to see you, Adriana.
Hi.
So I see there's quite a bit coming in. You have the tough task of synthesizing and editorializing. So what do we got?
Okay, so thank you everyone for sending your questions. I'll do my best to go over as many as we can during this live webinar, but then feel free to reach out to us at hpi@ada.org. If there's any unanswered questions, we could follow up later on. So Chris sent a question about the fall cliff, Marko. He asked, is there modeling for the fall cliff when patients recalls that would have been from March, April, May, then September, October, November? What patient volumes might be predicted to be? Is it 50%? What implications does it carry?
We're going to look at this. A lot of people have asked us this. We're going to try to get at in our next wave some sense of what do your appointments look like 3, 4, 5 months down the road. We don't have data on this right now. But if we can speculate, I guess the factors that play into that are, number one, how much of the patient volume right now is kind of pent-up demand versus routine care, right? And basically, I guess also, how do insurers handle a situation where I was due for recall in April, I went in July, does that mean my next recall is April plus 6 months? Or is it July plus 6 months? Which we don't know. So we'll take this under advisement and try to get some harder data on at least what appointment schedules look like down the road. It's a great question. This is a timing issue, right? So our consumer insights are very broad in general, but it's kind of like if you have 2 visits to do in the year, and let's say all those now have been crowded into a couple months, what happens to that second 6-month visit? Does it get spread out? Does it get delayed another few months? We don't know.
Okay, so the next question is not necessarily on the survey data, but I thought it was an interesting one. What impact do you anticipate that the loss of the enhanced unemployment benefits will have on consumers' ability to afford dental care? With cases resurging and more businesses announcing layoffs, bankruptcies, it makes sense that patients are deferring dental care that is needed due to the economic constraints.
Yeah, it's a great one. So we do expect some patient volume to be linked with economic activity and economic recovery. If you were with us a couple rounds ago, we redid all of our projections of the dental economy in the rest of this year in 2021 based on different assumptions of economic growth. But this issue of the stimulus money, in a sense, kind of quote unquote running out. And as far as I know, we still don't have word on whether that'll be extended or there'll be another $600 authorized, etc. I would say the direction would be on the negative side, but I don't know how large. Given current unemployment levels in the last, let's say, 2 months, like I'm not sure the patient volume we're seeing is unemployed people who are getting stimulus checks. We unfortunately don't have hard data on that. Is it folks that are still employed versus people that have lost their jobs just paying out of pocket to the dentist? So again, it's a good question. I don't have anything more to add on detail other than I do think it will have a slight negative effect on demand if that is not reauthorized for a second round.
Okay, thank you. Several questions about staff return to work, Marko, especially related on the reasons why they have not returned. So I'll just read a few. Some have speculated that the supplemental unemployment insurance implemented as a result of the CARES Act, $600 per week or $15 per hour, has potentially prevented some employees from returning to work. Said differently, they can earn more staying off their job. With that supplement set to expire at the end of the month, might offices be able to fully staff up and therefore see a higher level of patient volumes? And I'll read one more related to return, okay? Okay, so from Dan, hygienist reasons for not wanting to come back, is it related to the nature of the job, airborne threat, or is it unemployment compensation levels, or is it both?
So that last one, we're not going to know unless or until we ask hygienists themselves. And we are in the final rounds of figuring out how to partner with the Hygienists Association to do that type of research, right? So you don't want to ask the dentist what the hygienists are thinking, right? So hopefully we'll have that project in the field and going in the next few weeks. We don't have anything more to add on the data side on voluntarily, the employees that are voluntarily not coming back to work. My guess is part of it is concerns for safety. My guess is part of it is economic, right? Part of it is probably simply just, I don't know what you want to call it, work-life balance and caring for kids and parents and all sorts of things like that all of us are kind of grappling with, in our work lives and our home lives. But we don't have any research on which of those is most important. So at this stage, all I can say is it's likely a mishmash of all those factors. It's interesting, if the stimulus money runs out, we should pick up an effect on employment in the coming rounds, if not even the next round. So we'll probably be the first to answer that question, but can't do it today.
Okay, thank you. So this is a question that has been coming in past webinars. Are we going to report or look into COVID cases in dental offices? And then Richard always also asked, can you add more information on dentist death? I think you mentioned that as one of the options, and he mentioned that that was the first time he'd seen anything related.
Right. And again, that one was a self-reported write-in answer. And again, the big thing that, again, that's all, I don't know, we're data folks and we shouldn't talk about like somebody writing in this person died so flippantly, right? So it is tragic and you never want to see that, right? You know, we don't know if that transmission was via work or just via personal life. We don't know if it was during the shutdown, it's anything like that. But on the bigger issue of dentists, hygienists, other dental team members, the infection rates. So as I mentioned a few rounds ago, we'd been doing a project in the ADA. This is the science group in HPI. I've been collaborating to look at it would be the prevalence of COVID in, you know, the percent of dentists that have been diagnosed with COVID. And we're looking at that, and we're looking at as well, if you've done contact tracing, what was the source of infection? And if you haven't done contact tracing, what do you think the source of infection is? And we're trying to correlate that as well with use of PPE, etc. Long story short, those results are forthcoming. We'll share those when they're published, but we are looking at it. But to the other issue, again, I'm not the most knowledgeable on this, but as far as I know, we still don't have, I guess, documented reports of transmissions, at least that I know of. If other folks do, please write in. I know CDC a couple of weeks ago had a big webinar on this. But we'll have some data on, you know, how many dentists have been diagnosed with COVID. My guess is we'll have much rougher data on what the source of that infection was in terms of, was it at work, was it at home? But, you know, that's the best we can do for now. So stay tuned for that. We don't have results yet.
Okay, thank you. Colin asked, do you know how the staffing data differ, if at all, between private practice and safety net clinics?
So join us next week. I believe it's July 28th. We're going to do a webinar where we answer that question and much more. As you know, we survey dentists in private practice every 2 weeks. We survey dentists in public health settings every month. So we will be, and we have analyzed and we're going to present data next week. Adriana, do you know the time just off the top of my head, or Sylvia, if you could chime in? I know it's the 28th.
11 o'clock.
11 a.m. Central. So you'll all get a notice for that. So we'll see. I don't know off the top of my head what the results for that question were in terms of dentists in public health settings.
All right. A few questions in response to the teledentistry data that you shared. Jeff asked, were there any other questions about teledentistry besides D0140? Are people using teledentistry to do follow-ups, case presentation, etc.? And then we also received another question. Would more practices use teledental if there was better reimbursement? And lastly, somebody just added a comment. Carol Ann said, it's also hard to provide dental treatment through technology because it's a more hands-on profession.
So to Jeff and others who answered that, we have not asked those types of detailed questions. We certainly can. If you're interested in doing some custom questions with us, we would charge for that. But if you want that kind of detailed analysis, we certainly have a huge infrastructure to do that in HPI. So get in touch with us here if you're interested in that. But no, we just wanted a basic question on that for now. And again, I encourage others. There's lots of feedback we get about, have you looked at this? Can you add this question? Get in touch with us. If you're interested and the data are valuable to you and you want it just for you or your company, we can discuss that.
Okay, thank you. Gary had a question about loans and grants. Are you considering adding a question in the future regarding federal funds, whether dentists have applied for any grants or loans? it may impact future growth and expansion. And he did follow up with, dentists can still apply for the recent Medicaid CHIP grants and general dentist range.
So we will be adding a question in our probably next wave. We're just figuring out timing. When is it best to ask, whether you've applied, whether you've received. So on that part, we're going to do that definitely as a question of the week. Just a question of when, but we will cover that.
Okay, a few questions about cost of PPE. I'm having trouble finding PPE gowns that won't cost us $300 for 50 gowns. Do we have data on costs?
Don't have any data. Again, it would be a perfect custom project if somebody's interested. We get asked a lot as well, how much are dentists charging patients? If they are, how much are they charging? Or are they just kind of swallowing the cost? But we don't have bandwidth to look more in detail on those types of questions routinely on our core survey.
Okay, so a couple questions related to dental schools, Marko. One is, many dentists are employed by dental colleges and typically receive a base plus faculty practice plan income. Do we have any data on how COVID has impacted them? Or is this more of an idea question? And then,
yeah, we do not. Yeah, we do not. That's an easy one. Yeah.
Okay. And then Brian asked, with all the uncertainties of COVID, is this impacting dental school applications or enrollments?
Good question. Don't have an answer on that, but maybe we can look into data maybe for next time. My guess would be, well, I don't know. I wouldn't speculate on that one. I can see reasons why, and I can see reasons why not.
Regarding the consumer data, Barry asks, will you talk about the ready or not data and how it compares versus other industries or activities?
Yeah, we didn't put that up, but just to compare, dentistry is way more on the ready and ready with assurances, and a fairly small slice of that red pie. If you look at other industries, the restaurants, airline, other than retail, right? Visiting a retail store, people are pretty comfortable, but physician visits, slightly more comfortable than dentists, and then that's it. Then there's a big drop off. So again, the punchline here is dentistry among healthcare services is very high, and among any type of consumer activity ranks very high in terms of intentions and comfort and safety from the patient perspective.
Marko, perhaps to close, one more question. With the current COVID spike and a further resurgence expected in the fall, would you anticipate further guidance to close offices and non-essential services?
It's a good question. I mean, I'll give you my personal take, and obviously the ADA leadership, I mean, we're looking at this big time, right? Like, there are new protocols that are science-based. The public seems to be very comfortable. At least for now in the data, we don't have any sort of indications of transmission at all, let alone major transmission. We know the PPE supplies for now are pretty solid in general. So all this points to not having to do the shutdown like we did in March. So my guess is that's where the kind of advocacy will go, and again, in my view, rightly so. It's backed by science and data, but we'll see where the politics lead. I mean, these are decisions governors make and their state health authorities, right? But certainly on the ADA side, I think there's a strong inclination to, argue dentistry is essential, and hey, if you have PPE and you can follow the protocols, you should keep going. And the patients need it. Patients seem comfortable going to the office. There doesn't seem to be any major issues. It's probably one of the safer, more sanitized healthcare environments, etc. But again, that's my view and how the ADA is approaching it. But The decision makers are going to be the governors and the state authorities, and we'll see where that shakes out. Okay, I think we'll close on that. So thank you again. Look for the slides, look for the recording, look for us in 2 weeks again, and have a good rest of your day. Thank you.